This neighborhood is one of the poorest in Lahore. A large part of the population is illiterate. Here, no one has proper access to information about the COVID-19 vaccination campaign that started in the country last February. AMMAR, a civil society activist with the help of volunteers, is raising awareness amongst the poorest.
There are many rumors circulating. According to some, there's a microchip inside the vaccine which controls the vaccinated person. There's also a new rumor that claims people die 2 years after receiving the vaccine. None of this is true. And we now turn to Professor NOUSHEEN, who will answer your questions.
These residents rarely get the opportunity to meet health professionals.
Is the Chinese vaccine bad for you?
No, this vaccine's very good. It's scientifically approved. My parents got it.
Is the vaccine dangerous for people with diabetes and high blood sugar?
No, but COVID is high risk for diabetics, so they should get vaccinated ASAP.
All the educational campaign that the government is launching is through Twitter, which is not used by working class communities at all. So they are falling prey to really vicious propaganda. At the end, I think Corona will become a problem of just poor communities where people never got vaccinated. Poor areas will be seen as places of disease and COVID, among other diseases. So we have to resist that future.
My whole family was against getting vaccinated, but after this talk, we think we should.
AMMAR offers to take the participants to the nearest vaccination center to receive their first dose. A 20-minute trip in a rickshaw that these women cannot afford. The vaccination center is overwhelmed. The women accompanied by AMMAR wait while he tries to obtain their vaccination, being refused several times. They are waiting for several hours, while others who just arrive are taken care of. Quickly the tension rises between the people and police officers at the entrance of the corridors giving access to the vaccination rooms.
I've been waiting hours. The rich arrive and are immediately vaccinated.
There are people here who have been waiting for 6 hours. You can't do this. This is illegal.
We're being discriminated against because we're poor.
It is very difficult for us to come here because the vaccination centres are far away from where we live. We are poor. We can't even afford to pay for public transport, or we'll have to go hungry. It seems that nobody cares about us, the people who know the higher-ups are getting the vaccine.
AMMAR refuses to back down. After several heated exchanges and 4 hours of waiting, things start to move. The civil society activist is finally able to get the women inside.
You first have to fight the propaganda, then you have to build trust with them, then you have to convince them to take time out to come to the vaccination center, then you have to face mismanagement at the vaccination center. And this is the reality of the vaccine for working class populations.
The scenes at this vaccination center in the capital of the country are completely different. Every day, around 7,000 people are vaccinated here in a serene atmosphere.
It's quite easy, as a matter of fact, quite quick. I was not expecting. I think it's less than 5 minutes.
Inequality in the vaccination campaign worries the health experts like Dr. Jawad.
How they behave in different. My impression is that most of the people who have vaccinated are educated people, well-to-do people. It's not the poor people who have gone for the vaccination. Without vaccine equity, even if you have 20-30% population protected, you are not protected from outbreak. The vulnerable people will be moving around you, and again, you will get infected by some variant which has been now produced in some slum area.
In this rather poor district of Islamabad, a large part of the population is not entitled to the vaccine because of their irregular status. A valid identity document is required to be vaccinated in Pakistan. Here, most of the inhabitants, like ABDUL ZAHIR, are refugees from Afghanistan.
This is my bakery. 10 Afghan refugees work for me. All have expired papers. This is my refugee card. It expired 10 years ago. Nobody cares about us. We're human beings, but no vaccination is possible for us here. If an Afghan is infected here, then he can infect someone else. And COVID doesn't differentiate between Pakistanis and Afghans.
There are an estimated 3 million undocumented people living in Pakistan, mostly refugees but also Pakistanis who have never done any paperwork.